Good afternoon. My name is Vanita Voss. I am District Director for Congresswoman Underwood and just want to welcome you to our Mama Speaks breakout session. If everyone is in the right location, we can get started. I am going to introduce our panel, and forgive me, we have misplaced their tent card, so forgive me. So I'm going to ask you to wave when I introduce you, okay? So everybody knows who is in the room. And I'm just going to give a brief summary of each of our panelists here and our co-moderator, because I want you to really know and understand who is in the room, okay? Because these are some phenomenal women. So up first, we have our co-moderator, Mrs. Deborah Upshaw. She is president of the National Hookup of Black Women, the Joliet chapter. She's been a member since 2011 and served as president since 2015. She has a commitment to service that is illustrated by board service and her 29 years of distinguished service from the Illinois Department of Human Services Mental Health Division. She holds degrees in management and administration from Robert Morris University and Roosevelt University and is a proud member of Sigma Beta Delta International Honor Society in Business. She also serves as a steward at Brown Chapel AME Church. You are welcome. All right, Ms. Deb Upshaw. We also have Reverend Dr. Q English. She is the director of the Center for Faith-Based and Neighborhood Partnerships. The Partnerships Center at the U.S. Department of Health and Human Services serves as a liaison to the faith community and community organizations. The Partnerships Center works closely with the White House Office of Faith-Based and Neighborhood Partnerships. And again, I'm giving you a snippet of how amazing they are. She is a coalition builder and a network strategist. She also served, prior to joining HHS, she served at the state of New York, where she served as a deputy director of faith-based initiatives for the Governor's Office of Faith and Community Development Services. In this role, she identified opportunities to elevate strengths and build relationships with the faith-based community. She is also the founder and past president of Not on My Watch, Incorporated. She formed this organization to eradicate human trafficking and domestic violence through education, training, community engagement, and policy advocacy. In 2022, she became the city and state of New York's featured Dr. English within the top 10 of the state's 100 most influential religious leaders. Dr. English received both her master and doctorate degrees from the New York Theological Seminary. She was also the recipient of the Excellence in Ministry Award, the highest award given to a graduating doctoral student. We also have Tiffany Gardner, policy advocate for children and health, Futures Without Violence. She currently serves as federal policy advocate and works on federal policy and legislation addressing issues including domestic violence, maternal health, community health centers, mental health and child trauma, child welfare, and gun violence. She was actively engaged in coalition building, we see a theme here, right? And community organizing at local and state levels, focusing on violence prevention programs and strategies that would help reduce community violence, specifically within communities of color. Tiffany received her bachelor's degree in organizational communication and master's degree in community counseling from the University of North Carolina at Charlotte and completed her master's of public administration from Old Dominion University in fall 2020. She also serves on several boards, and she is native to North Carolina, where she spent over 7 years as a domestic violence counselor for children exposed to intimate partner violence. She has also served as trainer for law enforcement officers. Let's welcome Tiffany. We also have Emily Price. All right. Emily is the CEO of Count the Kicks. She oversees the national expansion of the evidence-based Count the Kicks public health campaign that educates and empowers expectant parents to track their baby's movements in the third trimester of pregnancy as a way to monitor baby's health. Count the Kicks helped lower Iowa's stillbirth rate by nearly 32% in the first decade, while the rest of the country remained relatively stagnant. And additionally, the stillbirth rate among Black women in Iowa decreased by a promising 39% in the first 5 years of the program. Price leads the vision of health Healthy Birthdays incorporated stillbirth prevention work with an overall goal of realizing a 32% stillbirth rate reduction in all 50 states, which would save more than 6,000 babies from preventable stillbirth every year and improve the lives of mothers. She knows the power of the program because it saved the life of her son, Hayden, in 2010. Let's welcome Emily. And then we have Dr. Erica Taylor, board-certified OBGYN, epidemiologist, public speaker, women's health advocate, physician leader, and change agent, right? We got the theme going still, right? She was born and raised in Harvey, Illinois. She has a Bachelor of Arts in Pre-Medicine and Biology. She's also served as a social services as a case manager for the Treatment Alternative for Safer Communities in Chicago. She received her doctorate in medicine from the Indiana University School of Medicine in Indianapolis. Dr. Taylor completed her residency in obstetrics and gynecology at Mercy Hospital in Chicago. And after graduation, she fulfilled a National Health Service commitment to the underserved at Access Community Healthcare in Blue Island, Illinois. She's board certified and the co-founder of Onyx Medical Wellness. We have a lot of information on Dr. Taylor. She was also a locums physician at Near North Healthcare and Southern Illinois School of Medicine in Springfield. Yes, she also serves. In addition, she engages in political advocacy via the annual Congressional Leadership Conference, advocating on Capitol Hill with physicians from across the nation on issues impacting the delivery of equitable healthcare to women. Dr. Taylor served as community mentor for medical students at Rosalind Franklin University, the Chicago Medical School. She also served on their admissions committee, which is very, very important for these students. Dr. Taylor is passionate about global health. Her travels have taken her to Nicaragua, Kenya, Sierra Leone, and Cuba. She is a proud member of Delta Sigma Theta sorority. I think we have some other Deltas out here. And she has been a frequent guest on numerous radio shows and keynote speaker as well. Let's welcome Dr. Taylor. At this point, I'm going to hand it over to my co-moderator, Mrs. Deborah Upshaw.
Well, thank you. And thank you guys for joining us today. At this time, we're going to ask Emily Price to begin with opening remarks.
Thank you. It's such a privilege to be here today. Thank you all so much for your hospitality and for setting this up. And I also want to thank Congresswoman Underwood and her entire team for making this day possible. I think the message today is that there are solutions to end this crisis. It doesn't have to be this way. That's why we're all here. That's what we're all here making change for. It doesn't have to be this way, and it shouldn't be this way. One example of that is on July 12th of this year, so not too long ago, President Biden signed a bill called the Maternal and Child Health Stillbirth Prevention Act. It was a bipartisan bill. If you sat in on the last session that was in this room, the Momnibus 101, they talked about the importance of bipartisan work, that if you have a mom or you are a mom, you should care about this. The Maternal and Child Health Stillbirth Prevention Act is something that our organization, Healthy Birthday, was the primary stakeholder of, and Congresswoman Adams was the lead on our bill in the House, and she worked really hard to get that passed. It was a bipartisan bill. The other lead in the House was a Republican from Iowa, our home state. Her name is Ashley Henson. And it's not, the Stillbirth Prevention Act was not part of the Momnibus, but it is something that is a collective win for all of us that this happened, and a bipartisan win that happened and would never have happened without the leadership of Congresswoman Adams. And Congresswoman Underwood was one of the very first co-sponsors to sign on to that bill as well, and we're so deeply grateful that she did that, and she continues to advocate for stillbirth prevention across this country. There's a real-life impact to the work that we're all doing, and the real-life impact of the Stillbirth Prevention Act is my son and what it would do for families all across this country. And I think that's what I keep thinking about when I sit in these wonderful sessions today, is the real-life impact of this work, the real-life impact you're having in your community, the real-life impact that Congresswoman Underwood and her team are having here in Joliet and all across the country as well. For me, it's really personal. As you heard Vanita mention, this program saved the life of my son, and it saved the life of 30 babies in 36 states and in 6 countries. And here's what it does. I'll just share briefly what it is, and it's just an example of how legislation can lead to lives being saved. I was 30 weeks pregnant 14 years ago. My son was our first pregnancy. I was 30 weeks along, and I noticed a change in his movements in utero. I noticed that something was different and something was off. And I had been educated about a program that started in Iowa by 5 women who had all lost their daughters to stillbirth. What you see on the screen now is actually just some of the lives that have been saved by the program. What it does is educate moms, get to know your baby's normal movement pattern in the 3rd trimester, speak up if you notice a change. Because oftentimes a change in a baby's movements is a precursor to stillbirth. That baby is trying to tell mom something is wrong. It could be something like the start of a placental abruption, the start of a maternal fetal hemorrhage, the start of an umbilical cord complication. Baby is conserving energy or is not doing well because of some of these things starting to happen. So when they become weaker, they move differently. It's that warning sign to mom that something is changing and she needs to go tell her doctor. And the biggest piece of the puzzle here is that her doctor then needs to listen and take her seriously to help get that baby here safely. Well, long story short, at 30 weeks along, when I spoke up and I told my doctor that something has changed, I got lucky that she did listen to me and she did take me seriously. She sent me downtown for tests. And what they noticed was I was in very active early preterm labor at 30 weeks along. My son was coming at 30 weeks, which is too early. 14 years ago especially, we've had a lot of improvements made since then, but even today, it's still scary to deliver your baby at 30 weeks. When I got to the hospital, they said, okay, so the test showed that you're in very early active labor. The first thing we're going to do is give you a shot. It's a steroid for your son's lungs. So if he is born this weekend, it'll give him a better chance of survival. And when they used the word survival, my husband and I looked at each other and realized just how serious it was. This is actually something that plays out every single day in our country, this kind of conversation. And so I was admitted to the hospital. I stayed there for 4 long days. And while I was there under strict surveillance, they started me on a daily pill called Procardia, which helps stop contractions. And then after 4 days, it started to work. So they sent me home on very strict bed rest. And they said, you're going to spend the rest of your pregnancy in bed, except to maybe get out of bed to shower once a week. And, we're going to hope that this works. And long story short, it did. The daily pill called Procardia to help stop our contractions and staying on strict bed rest worked. My son was born completely healthy in the 40th week of pregnancy, not a minute in a NICU, and absolutely nothing wrong with him. He just started high school, actually this week. Thank you. But the storyline is that every mom deserves that. Every family deserves a healthy pregnancy. I got lucky because I lived in a state that had this program, that started this program. I got lucky, and I know that I got lucky. But every mom deserves to have all of the education and tools and resources that they need to get their baby here safely. And so this is what Count the Kicks looks like. We can talk a little bit more about Count the Kicks later. But with the Stillbirth Prevention Act and the work that Congresswoman Underwood and Adams and many others have done is to get this in the hands of more moms and more families, to let them know that this is one tool and one resource. It's not going to solve the crisis. It's not going to end the crisis. It is one tool in our toolbox, a very powerful tool in our toolbox to help get more babies and more moms here safely. We know that a change in a baby's movements, when moms feel that, we also have information that it's really helped a lot of moms identify things like undiagnosed preeclampsia. The things like the start of a placental abruption can also be very deadly for mom as well. And so this early warning sign, this early warning system is helping moms and their health as well. And so that's the real life impact when we all come together and we have things like the Momnibus in place. We know that more lives will be saved. There is a link between stillbirth and maternal mortality. So stillbirth is the loss of a baby at 20 weeks or greater during pregnancy. It basically is what happens after miscarriage. And the link between stillbirth and maternal mortality and what the Momnibus is addressing is that women who endure a stillbirth are now 4 to 5 times more likely to lose their own life. And Congresswoman Underwood understands that, and Congresswoman Adams. And so stillbirth prevention is not just a method to get more babies here safely, but to, again, improve mom's health as well. And so what I would say is we start this panel and we talk about advocating for ourselves and empowering expectant parents. The whole point is that we do have solutions. We have ways to help get babies here safely and to improve outcomes. Doulas are key. There are a wide variety of things that can help improve outcomes and save the lives of moms and babies. And I'm just really honored and humbled to be sitting among you today on this panel to learn from and for all of us to collaborate, because I know lives are going to be saved because of this day. So thank you.
Thank you. Thank you, Emily. We will now begin our question and discussion period. And for question number 1, everyone would answer but Emily. You just heard from her, okay? So we're going to set the clock for 4 minutes each. Panelists, other than you, will have 4 minutes, okay? So the question is, could each of you briefly talk about your work and how it impacts the maternal health space? So we're going to begin with you, Tiffany. Okay.
Well, good afternoon, everyone. I'm so glad I'm echoing the same sentiment, so glad to join you all today. So again, Tiffany Garner, and I work with Futures Without Violence, and I serve, as Benita mentioned in my intro, as a federal policy advocate. But I would like to say that it's an honor to be here because to serve on this panel this year, to bring a unique perspective to the maternal health crisis. I have worked in domestic violence field for 20 years. You'll hear me interchangeably use domestic violence versus intimate partner violence. Back in North Carolina, I used to serve as a community organizer where I would go out and train and talk a lot about what intimate partner violence looks like. And at that time, I didn't realize I was going to be doing the work around maternal health, but I noticed the rise and the stark issues that we are having in society around intimate partner violence. Fast forward years later, like I said, I've been in various capacities with intimate partner violence work, to now be in a space where I'm looking at some of the intersections. Oh, let me take that back. Let me go back. After doing a community organizing and serving as a counselor and working with women and children who were exposed to violence, that's where I started also learning from a lot of women that would come to our agency in Charlotte, North Carolina, who had children who were in the home, and they were witnessing excruciating physical violence as well as the emotional and sexual violence also was present. Some of these women that we would serve and work with were also pregnant. And so we would do some trainings and some work with women to help educate them about the impact of domestic violence on a baby that is in utero, because of the connection between the moms and the biochemistry of the baby that we did start to see a lot of moms deliver babies who were low birth weight or had issues in being very colicky. And at that time, I mean, this was years ago, but at the time I know a lot of people, healthcare professionals would, of course, provide the advice that you would need to, of course, calm your baby and take care of your baby, but no one was addressing domestic violence or asking the deeper questions as to what's going on in the home. So fast forward to now, it's an honor to work at Futures Without Violence, where we work to support the Momnibus Act because there are some key pieces on here that we're looking at. At Futures Without Violence, we're the hub for the National Health Resource on Domestic Violence, where we train healthcare professionals, as well as we are home to the Health Partners in IPV and Exploitation, which is where we also work with federally funded community health centers to train staff around human trafficking as well as IPV or intimate partner violence. And so for my work, I'll continue to advocate for legislation, as well as we have some funding that a bill that we're also looking at too. Maybe one day we can scoop that in the Momnibus, but we have a bill called Protect Moms from Domestic Violence, which also looks at doing some funding to do studies and to do some other programming work for community-based organizations who are addressing intersections around intimate partner violence, as well as human trafficking and sexual assault cases, because these are serious. Again, a stat for everyone here, and there may be those who are experiencing it here in the audience, every 9 seconds a woman experiences severe physical abuse. Of course, we also see 1 in 4 women are victims of domestic violence. And then, of course, as we look at some of the stats around IPV and pregnancy, there's been some studies out there that's looked at research that 15 to 44-year-olds, that there's a 16% greater chance that women who are pregnant in those age groups, or in that age group, will experience a homicide or be a victim of a homicide. So I come to this work from personal experience, but also to look at another side, another layer to the maternal health crisis that we probably should all start looking at is what's happening. You got the obstetric side of it, but also looking at some of the personal experiences that a lot of women are having around death and homicide rates of women who are experiencing this, which is very concerning. So that's a little snippet. I know I'm on time. I know you're watching me, Ms. Deborah.
Thank you. What an awesome job you're doing. At this time, we're going to hear from Reverend Dr. K. English. And Reverend Dr. K, hold on one second so I can set you for 4 minutes.
I know what it is. I know why she's doing that. Because what she's saying is you don't give a reverend a mic.
Yes!
So I totally understand. Is it my time now? Okay.
Yes.
So for those that just walked in, I'm Reverend Dr. Q English. I serve as the director for the Center for Faith-Based and Neighborhood Partnerships at the U.S. Department of Health and Human Services in Washington, D.C., where the Honorable Javier Becerra serves as our secretary. I am a Biden-Harris appointee and proud to be. And so the work that we do there at the center, when it comes to maternal health, we focus on, youth mental health and suicide prevention and ongoing work around substance use disorder. But this piece is really dear to my heart. From lived experience, I'm almost losing my daughter twice, preventable, definitely there with the preeclampsia. But the reason what drew me into this space is the fact that I was in federal, sitting in my office in Washington, D.C., and I started looking at all of the announcements we were making about the strides we're making in maternal health. I was seeing all the social media posts, and I do want to just take a moment just to applaud our Representative Lauren Underwood for championing the work that she's doing.
Yes.
And so I said, what's important to me is that we go to the community, not just send an email or a social media post or et cetera, but go to the community that need these services and resources the most and connect them real time on site. My background is advocacy. I used to get arrested every Martin Luther King Day, so I am grassroots. Okay, so that part of that. My makeup sort of married that directorship, and now I have this HSSN White House approved Moms Tour, which is Maternal Outcomes Matter showers, where we're doing nationally, targeting the African American and American Indian, Alaska Native population, and we're going to the cities that have high maternal mortality and morbidity rates. And that's important. And when I started hearing suicide is a leading cause of death for women postpartum 6 to 12 months, our newest monster that we're facing is congenital syphilis, numbers tripling from 2018 to 2022. Then we're hearing that those prenatal, approximately 30%, morbidity issues because they don't have insurance. And then we're hearing from the CDC, yes to doulas, and yes to midwifery services. But we're not getting it to the community. That's why I created the Moms Tour. So the Moms Tour is a stop in 25 cities this year. We've already done 13. I just came back from Flint in Kansas City, Kansas, where we're actually connecting these pregnant and postpartum women real time on site with the services they need. Mental health care, WIC, our Healthy Start programs. We have doula, midwifery services, and we're not forgetting about the men. We have a dad's den. Why? Because they're suffering as well. It's not I'm pregnant, it's we're pregnant. And so we have that dedicated time for the men to have private conversation who's talking about their suicidal ideations and talking about postpartum depression. The way we're drawing them in, I have a fiscal administrator that walks alongside of us and throws a community baby shower, but once they end, I have a captive audience. And so I've had about 600, between 600 and 700 was our largest crowd. And there I'm able to educate, empower. So we have a mental health specialist that talks to them about what is postpartum depression. A lot of them don't even know how to define postpartum, just getting them to understand they're having these mental health challenges. And I always say it's okay not to be okay. It's just not okay not to get help. And so we're able to connect them real time on site with mental health care, with doula services, with midwifery services, and it's been extraordinary. And then we're able to talk to them about what is preeclampsia. I am suffering, I'm having these headaches, the dizziness, etc. And it's ongoing. getting them to identify what are those pressing issues that you need to go to your doctor about. And when you go to your doctor, I want you to feel empowered. And if you keep going to your doctor and they're not listening to you, then fire your doctor.
Yes.
So we're very clear on helping these women feel empowered as pregnant and postpartum women. And I call this whole space the village many of them didn't know existed, where they're able to be connected real time on site. Last year, real quick, pilot, we touched about 5,000 women, connected over 1,700 at mental health services, 800 at doula and midwifery services, and the champion of our maternal health blueprint, our very own Vice President Kamala Harris, had expressed a need for us to expand the perinatal workforce. And so with that in mind, I have someone else traveling alongside of us that is now certified over 500 African American doulas in our nation. And so the work is going to continue, and we've touched over 10,000 women and families to date. Thank you.
Well, Dr. K, I thought we was going to have time, the cues, to take up an offering, but you went over.
Okay. I'll stay after later.
Okay. Thank you for that. The work that you're doing is awesome. So at this time, we're going to hear from Dr. Erica Taylor.
All right. So first of all, I want to say I'm on this panel with a group of esteemed panelists. I'm just honored to be here with each and every one of you. And so my work has been, I've had a long commitment to working in safety net hospitals. I've actually worked at not one, but 2 hospitals that are currently closed. And so we're dealing with the issue of maternity deserts on the south side of Chicago.
Yes.
I was at Mercy Hospital. I trained there, ended up being there until the doors closed in May of 2021. In some of the work there, we were looking at issues such as preeclampsia, and we saw that there was really an urgent need to have education, not just in our OB department, but also to educate the other departments that touch these patients. So typically when patients come in through the emergency department, many times they were sitting there for 6, 8, 12 hours or longer. And so they would come back with something called postpartum preeclampsia, so elevated blood pressures and protein after delivery. And so instead of them being fast-tracked, they would often sit there, and sometimes the women would seize. And so we actually developed a program where the moms would actually receive a bracelet. So if you were within 6 weeks of delivering, you would actually be fast-tracked through the ER, and that really helped to decrease some of these issues. In regards to maternal mortality and morbidity, the thought is that more than 80% of these conditions are preventable. And so again, I think we have to get to the crux of the issue, not only education of the clinicians that touch the patients, but also patient education, the use of doulas, educating the families too. So if there are issues, are you having issues with headache? Are you having blurry vision? Are you having pain on the right upper side of your belly? And so really, I think that's key in regards to helping us deal with some of these issues. And then in regards to fetal demise, I just wanted to just touch on that a little bit because that's a very personal and professional issue for me. I actually had a cousin that had a stillbirth during the pandemic. So had a completely uncomplicated pregnancy, made it to 38, 39 weeks, ended up going in not having any fetal heart tones. And just totally unexpected, nothing was found on autopsy. And so we have actually been working together, trying to figure out some initiative that we can create together. Right now it's Mustard Seed Birth Initiative, and we're trying to flesh it out to figure out how we can use some innovation to help other moms not undergo the issue that she went through. She was actually in the New York area at that time, and they were going through virtual telehealth. I mean, I feel like telehealth has been a blessing, but also a curse. In certain conditions, patients need to be seen, they need to be touched. And so I feel like it's definitely something that could have been prevented. And so, this program, Kid Counts, I think is absolutely amazing. Yes. We have things like that out here. Also in regards to maternal health, we see that Black women are dying at a much higher rate. We're seeing that 3 to 4 times the rate of our white counterparts, regardless of our educational background, our economic status, our insurance status. In Chicago, those rates are sometimes up to 5 to 6 times that rate. And so I feel that we need to start looking at something called preconception treatment. And when we talk to patients and we talk to people in the community, most patients are not receiving that preconception visit. So actually having a mom, before you even decide to get pregnant, you should be seeing your doctor or a clinician. And so let's talk about some of the chronic issues. So things like high blood pressure, diabetes. Let's get those things well controlled before we even initiate a pregnancy. Because the thing is, if you're going into a pregnancy and you already have those underlying conditions that are unchecked, it's only going to exacerbate during the pregnancy. And so also this whole thing in regards to like the baby aspirin, some patients are not even aware that they should be taking a baby aspirin. Pretty much almost every pregnant woman, if you go through the list, there's a list of like severe and moderate risk factors for the patients developing preeclampsia. So if you're Black, if you're obese, if you have a history of high blood pressure, and the list goes on and on. And so really, I would say 85–90% of patients should be taking a baby aspirin during pregnancy. And I think also we need to have more education in our community, like the grassroots approach. So really taking the medicine, taking the health to the people. And so really reaching them and meeting them where they are. I've actually had the fortune of working at an FQHC where I'm doing something called centering in pregnancy. And so it's group prenatal care. And we are really seeing that the outcomes in regards to preterm labor are decreased. Also, we see increase in compliance. And so we had an opt-out model where patients would actually, we would invite them to come into the visit. And so it's usually a 2-hour visit, which, you know, most patients are having a 10 or 15-minute OB visit, unfortunately. And so they would actually come in, and so we're actually doing education during that time. We would do a healthy meal. We would have actually family input, so we did a lot of talk around intimate partner violence, looking at things such as postpartum depression, because I think a lot of times, you know, we can't address everything, unfortunately, in that 15-minute visit. And so when we're looking at things like managed care, I feel like a centering model actually really affords us the opportunity to really have an impact in regards to these poor outcomes that we're having in our patients.
Well, thank you. Thank you, Dr. Taylor. Now, this question, you will be asked again. Dr. Taylor and Ms. Emily Price will answer this question, and you will only have 3 minutes. So since we're going over the 4, and we only have 1 hour, so let's be cognizant of that. Look down here, okay? So the question is, in terms of amplifying our voices for our expectant and postpartum mothers and their families, how can they make their voices heard in the moment when they feel something is wrong? And how can we get providers to listen and take action? So Emily and Dr. Taylor, we'll start with you, Emily.
I guess I'd start by saying it's a shame that we even have to ask this question, right?
Right.
We should be listened to and believed the first time and every time. But thank you for asking it. I guess my mind goes a couple of places. And of course, I would internally just, I think about Count the Kicks and how Count the Kicks is used as an empowering tool. So if we talk about the moms, let's start there. With that, we have a free kick counting app, which you might have seen on the screen earlier. And it's a way for moms to have their daily kick counting session, pay attention to their baby's movements, and get to know what their baby's normal is. And so within that, they get to see their data every single day. They start to see their trend line, their baby's normal trend line. And I know that this helps women be believed when they start to see a concern. So oftentimes, so I guess one of the things I would say is have moms that you might be working with in the prenatal space download the app. It's totally free. It is available in 21 languages. There are no ads. There are no pop-ups. We don't sell their information. We don't share their information. We're a nonprofit that just wants expectant parents to get to know what's normal. So then they start to see a trend line, what's normal for their baby. So if all of a sudden their baby's normal changes, the graph over their trend line is going to shoot way up and show that there's a difference. And we have had moms come to us and say, I wasn't being believed. I noticed that there was a change in my baby's movements. I wasn't being believed. I showed them the app and I said, look, something is off. Something is different. And they finally took me seriously. So that's one tool in the toolbox that they could use as a way to finally be listened, finally be understood. Within our organization, we know that providers have to be educated on this as well, and that they have to be educated on leaving their biases at the door, at listening every single time, to paying attention to a mom when she speaks up. And so that's sort of the second part of the equation for our organization, at least, is to we need more training among health workers to listen to expectant parents when they have concerns, and to follow that protocol of what you should do when a mom comes in with a concern. And so we're at 2 minutes, so I'll stop.
All right, thank you. Same question for you, Dr. Taylor.
Okay, so when we talk about amplifying the voices of our patients, I think first it starts with selecting a clinician that you feel comfortable with. I think if you have that good physician-patient relationship, I think you're going to have someone who's going to listen to you. And I think it's like, I feel like, I say when you're finding a physician, it's like dating. Sometimes you have to kiss a few frogs to find the right one. And so I think also word of mouth is very important. So people that have had very good birth experiences, I think, asking friends and family members like, who delivered you or what have you, and see how their experience was. I think also when we look at the issue of implicit bias, I think we also have to work on educating our clinicians. And I feel that should actually start in medical school. And it can't just be you go online and do a 30-minute module where you're just clicking through. I feel like we as clinicians, we need to actually be indoctrinated into the patient's life. So when I think back to when I was a third-year medical student, I did my family medicine rotation in Gary. And so I actually had to go, I went to the patient's house that morning. We rode to the clinic together. I sat there with her for several hours while she had her visit. Afterwards, I went with her to Walgreens, and she had to decide, which prescription she would be able to fill that day just because of financial issues. And so I really feel like we have to take a walk in the patient's shoes. And until that happens, we're going to continue to have these issues where patients are dismissed, they're not being listened to. And then there's the whole issue of, when we talk about Black women in pain, and there's this whole thought that Black women don't experience pain like white people or Latinx people. And, a lot of that goes back to, we don't call him the father anymore, but the father of gynecology, Dr. Sims, who actually did much of the work that was done in women's health was actually done on slaves without any anesthesia. And so again, I think some of that is still propagated here in 2024. And so I think we also have to educate in regards to that. There are, when I think about as a resident, there were many people who were not educated about the ills that our Black slaves went through in regards to how women's health was advanced. So I think there is really just a need for more education. And then also patients, the use of doulas, I think that can also help with empowerment. And so if you're someone who's in a labor setting, you may not be able to speak up for yourself. But if you have that doula present, which is great here in the state of Illinois, I know within our Cook County health system, any woman that's delivering there, they actually have access to a doula without any fee. And so again, I think that can go a long way. But I know statewide or nationwide, we're not seeing the use of doulas, or even in other states, like I did a talk over in Indiana, they don't use midwives. And so really, how can we start to use midwives too, so that we have this huge interdisciplinary team that's going to be a support and a scalpel for the patient when they're dealing with the maternal health system.
Well, thank you. Such great information. So our next question will be for Dr. Q and Tiffany. You also have 3 minutes, Dr. Reverend. Okay, in terms of amplifying our voices as a maternal health village, how can we work together to improve outcomes for moms and babies? What actions can we take as individuals and organizations to ensure this remains a priority and to affect positive change?
Do you want to go first?
No, go.
Reverend?
You was ready, so
No. I was just thinking. No, I'm sorry about that. Yeah. So I have so many thoughts in mind, but I know I have 3 minutes. One is, I always say, what angers you is what you're assigned to solve. What saddens you is what you're assigned to heal, right? That's like destiny and purpose kissing, right? And what angers you, see, you taking up my 3 minutes. No, I'm messing with you. What angers you is what you're assigned to solve. What saddens you is what you're assigned to heal. Yeah. So it's like destiny and purpose kissing, right? It's sort of like what makes you tick, what makes you talk, what gets you going in the morning. And I'm saying, put that to full use. Don't let the opportunity to engage, don't just show up at conferences and convenings and summits and take notes and do nothing. And a lot of you are doing a lot. But because of where we are in this nation today, we have to do more. So if the village, I ask you to please be a part of the village or create the village. And that village should look like community leaders. It should look like faith leaders. It should look like the neighbor next door. It should look like maternal health organizations, Department of Health. It should look like things that should be existing, particularly in these cities that have these high rates of morbidity and mortality. And I'm gonna say it again, if it doesn't exist, create it. And how do you build Rome? Rome wasn't built in a day. How do you eat an elephant? One bite at a time. And the way I am motivated is I think of the fact that as long as there's breath, there is hope. So every day, while we're still facing these alarming places on a practical level, find yourself a way to be a part of the village. In government, in my role, what I think of and everything that I do, because we never know what's going to happen in government, I go to the communities to build the village so that it can be sustainable, because there was a day when our village could raise its children. And so we want to restore that. My last recommendation is if you're a faith, part of the faith community, what we're doing around the nation is we're identifying congregation members that can become doulas, because we are the trusted messengers. And so if I have pregnant and postpartum women in my house of worship, it makes sense to expand the perinatal workforce with doulas within my own congregation. Case in point, one church has certified 40 doulas. Not only are they helping who's in the house of worship, but their community at large. And definitely be a part of the Moms Tour. And I can work with you in even replicating it coming in 2025. Thank you.
Wow, that was wonderful. Tiffany?
All right, so I'm going to add on and be a part of the village here by talking about the importance for everyone, regardless if you're doula, advocate, whatever your role is. Please educate yourselves around what intimate partner violence looks like. I know that, again, I know it's a newer voice at the table or a newer perspective, but please understand how many of our sisters, and I'm saying sisters because that would just include everybody, women's lives, are being taken by their intimate partner. Please, I have plenty of stats, but I would encourage you all to do some research on your own. But also, in addition to understanding what this looks like and how many women are losing their lives due to homicides and firearms. I know that that's a testy thing to talk about. I'm not trying to politicize it, but I'm being real. That in this country, there are close to 500 million guns circulating, right? And so you have women who are pregnant. It should be the most sacred and precious time of your life, but you are also at the same time of dealing with some of the systemic things that my sisters here on the panel are talking about that you're facing as you are, seeking care. Also, just imagine how many women go to seek care but then go home to an abusive and unsafe environment. So you're talking about layered and complex situations. So I encourage all of y'all to educate yourselves on what domestic violence, intimate partner violence looks like, what it is. It's a pattern of behavior that is rooted and grounded in power and control issues. It shows up. It is physical violence, but sometimes it doesn't show up to the naked eye. It could be emotional and financial abuse that your client or your person that you're serving, or it could be you in the room that's going through. So I encourage you all first educate what domestic violence looks like. We also encourage please connect and have a relationship with a domestic violence agency within your communities. One of the things that we support, and like I told you all before, we are the hub for the National Resource Center on health and domestic violence, and so we do a lot of training. Whether it's community health centers or it could just be health professionals, doulas, midwives, it doesn't matter, about what it looks like at this intersection, but also how important it is to use this particular model, which we call Q's model. C, I know, kind of like your name. Yeah, she just gave me off track, but that was good. Q's, C-U-E-S. So Q. So the C stands for confidentiality. So this is really trying to look at, even if as an advocate you're in the community, you're working with someone, what are your current confidentiality laws within your own state? So what does confidentiality looks like if you're within your organization and your policies there? The second thing is universal education and empowerment. And so this comes along with before you even dive into asking questions, because oftentimes we do see agencies that have check boxes that says, are you going through domestic violence, or are you a victim of domestic violence? Check yes or no. But then it's like, okay, that seemed impersonal because it's like, then what? So we are advocating the opposite of that. Don't get me wrong, please screen if you already are, but we're suggesting another thought process as to before you even ask those questions, go ahead and just share about the importance of it, relationship safety. We provide at Futures Without Violence safety cards, which are these little small, very small cards, kind of like business cards, that walks people through what your relationship, I guess I want to say let's just say what a healthy relationship look like. I was going to say in connection to your own health. We have those available too. But these are cards that we also have professionals, it could be a doctor's office or advocates, give out. And so that empowers people. Before you need to ask what's going on, you're already letting them know this is what relationship health looks like. And then you can connect them already to, if you or someone you know are going through something, that this is an agency in your community that you can connect people to. And then, yes, I got off track. Okay. And then support. Okay. Yes, Ms. Deborah. Okay. Let me get the S. Okay. And then support, which is continuously to support that person through whatever their decision is. And I was just going to say, the last piece, Ms. Deborah, is the fact that just because you may share in a confidential and empowering way, but understand that oftentimes a lot of women who are pregnant and going through all these other systemic issues may not leave their partner, although the situation is dangerous, because this may be the only source of economic support or support period in their life. So we have to remove our expectations, even though you educate and empower people when it comes to domestic violence, because that too may be layered as to why people stay. Sorry.
Well, thank you.
Thank you.
So
You should call her Reverend Doctor.
I give her your other 30 seconds, okay?
Okay.
So this question, our last question will be for all of you guys on the panel, okay? And guess what? You only have 2 minutes.
Oh, my gracious.
So it gets worse, right? Because I know you're excited about the work you're doing, and we're excited to hear it, but this is only an hour session, okay?
Yes, ma'am.
Okay, so the question is, what is one takeaway you want to share with our audience today to either drive home to the magnitude of the maternal health crisis or provide an actionable step we each can take to improve maternal health outcomes in our communities? Okay, so Dr. Taylor, we will start with you and come on down the row. 2 minutes.
Okay. So I would have to say that we have to look at the fact that 80% of maternal deaths are preventable. And so really looking to see what we can do from a systemic standpoint in regards to addressing the social determinants of health. I feel like we have to look at, the communities in which our patients are living in. We have to look at the nutritional status. So we often have communities where there's a liquor store and a fried chicken place on every corner, and we talk about, patients being, adherent to eating, a well-balanced diet. I feel like we have to start to, prescribe more nutrition instead of prescriptions. And so really looking at things that we can do to be preventive and proactive in nature rather than reactive. So again, I'm going to say, let's go back to having the intervention of preconceptual counseling and visits. And that way, I think that will help in regards to decreasing the burden on our healthcare system in regards to maternal mortality, and then also educate and empower.
Thank you.
And I'm going to be under 2 minutes because I just really want to reiterate, for many of us, we have to start with our family. I think I told you, my daughter almost lost her life twice, preeclampsia. And I'm going to repeat, find the village or create one person at a time. Help elevate existing pro-maternal health messaging through your own channels, social media, Facebook, etc. And then avail yourselves. We created the first national, it's also faith and community in action guide on maternal health. It gives you practical steps of what you can do in your community. I have a lot. You can take as many as you want. I have some upstairs as well. But just as an example, as part of my 2 minutes, is that it gives what can pregnant people do what can pregnant people and their families do? So it's a toolkit in giving them instructions on what they can do as well. It also gives recommendations for faith and community leaders step by step. You can talk about maternal health with your congregation or your community members. You can build community capacity to support pregnant women, and the list goes on and on. I'm not going to go through it all, but as you can see, it's well-rounded and very practical that you can implement in your own organization, whether it's a community-based organization or a faith-based organization, and our tools are left behind. Thank you so much.
Thank you.
All right, so real quickly, I think I would just leave you all on this note that we can't reduce maternal mortality without addressing domestic violence. I recognize the perspective, and maybe there's more education around this intersection needs to happen, and happy to do so, and along with so many other advocates. But I really want us to really understand and drive home that point of the role that plays in a lot of our deaths of women. Of course, and especially our younger women, those who are under 18 as well. The rates of teen dating violence or situations are very stark, and of course, a lot of our young women are birthing. So just want to leave with that. Also, if you all just let me know if you're interested in more information around the CUES model and how you can implement that. If you are, does not matter, like I said, an advocate to community health center worker, community health workers, because everyone is vital in our community or our village here to do the work. So we're happy to help train and help you around this model to institute, because again, that is just a universal approach to educating everybody about domestic violence and how it impacts your health and your baby that's in utero or just born. And then the last thing I was going to talk about is just the important role of maternal mortality surveillance committees around the country. Every state, I think, has those. And so just personally, because this is where a lot of the research and data is pulled in our world to look at the rates of death, or the causes of death, of maternal death, and that's where we kind of look at what's happening around the violence perspective. So if you can, understand what's happening in your state around those particular committees and make sure that those stay funded, right? So contact your legislators and make sure they are aware of why these committees are so important, because this is where the data comes from to understand what our states are looking at when it comes to death, unnecessary preventable death of women by homicide rates. So thank you.
Thank you.
My call to action would be to keep believing in yourself and keep believing that things are going to change, and don't give up hope. It's easy to give up hope in this kind of work, but don't. It sometimes just takes one conversation can save a life. One call to action of download the free Count the Kicks app can help save a life. Let someone know to pay attention to their baby's movements in the third trimester and to speak up if they notice a change. If any of you would like any of our free resources, we have an amazing Illinois ambassador, Sheila Vukovic, who's here in the front row, who would be happy to share them with you. Our website, countthekicks.org, there are lots of free materials on there, depending on what state you're in. They're either free or low cost. And again, one conversation can save a life, whether it's recommending a doula to a friend or a hospital or a doctor that will listen to you or your friend who is pregnant. Just one conversation makes all the difference sometimes. So keep doing the incredible work you're doing, and don't lose hope.
Thank you. Let's give all our panelists a big round of applause. We're a little behind.
So we are a little behind, and we started a little late because of our previous panel. So if you'd like to stick around, give us a little grace for a few more minutes, we'll open it up for any audience questions. Okay.
I'm a retired nurse, and I currently work for the Crisis Center of South Suburbia. So my job 3 days a week is to go to a local hospital, Little Company of Mary, I'm sure most of you know them, or Christ Hospital. Last month, I did domestic violence screenings on over 400 individuals, males and females. It is a screening process. Sometimes it takes a minute, sometimes it takes 45 minutes. All the time it is necessary, but it's not enough. We're only at Christ Little Company of Mary, Silver Cross Hospital, and we're going into Palos. And we know that this is going on everywhere. I also work with my church with this as well. So thank you for what you are doing. I really appreciate it. It's so important. Keep doing that work.
I'd just like to thank you all for being here. As a community-based doula, there's a lot of power here. So I am right outside of Chicago with Twin Sister. I was wondering how we'd be able to get involved with the Moms Tour.
Oh, Mom's Tour is coming to Joliet October 13th. So we would love for you to be involved. I'd love to have you to be part of the village and offering your services. That would be amazing. And anybody that want to reach me, I'm at q.english@hhs.gov, and I do answer my emails. It's que.english@hhs.gov. Love to talk about how we can expand it as we think about movement in the days ahead, as well as some of the other programs that we launched. Thank you.
Thank you.
And Vanita, you have that on the download QR code, the flyer thingy. You'll make sure you get it.
Not a question, but a comment. I mean, this was really great information. And one of the things I found, because I always wondered, I mean, they always talk about the mother, but what about the father?
Yeah.
You know, as far as giving information to them, because I think they should be trained or they should know exactly what's going on. I know as a parent or as also a dad, I went to every appointment. I went through all the little training to make sure I knew what was going on with her body so I could help understand. Because one of the things I noticed being a health equity manager when we're dealing with people in our underserved communities that they suffer a lot with just nutrition. I mean, just common everyday things that are going on in their lives, and that can affect their pregnancy. So for me, I'm not a clinician. I'm a health equity manager, but this is really great, and I'm really glad I got an opportunity to attend today. So thank you.
Thank you.
Fantastic.
We'll turn it back over to Deb. I believe we're going to offer some last remarks, and then we will close.
Okay, this has been an awesome panel. Would you agree? So as we wrap up things, we're going to ask each one for closing remarks. Right, Vanita? Okay, all right. So we're going to start with you, Doctor.
Oh, Lord, let's see here.
Closing remarks.
Come back to me. Give me 1 second here.
Okay, you want to go to the
Yeah.
Reverend Doctor? Reverend Doctor?
I just want to say that, you know, it's always such an honor to be in spaces like this, to be with people who care, you know, and not only care, but have the wherewithal and the ability to do something about it. And if I thought about it, if you're a doula in this place, work with your OBGYN and your midwife. If in the midwifery services, work with your OBGYN and the doula. I just feel like that village needs to be more intentionally connected. And it's not a competition because we need this holistic approach, and our pregnant and postpartum women need as many resources as we possibly can get. I read an article, and I'll close with this, that talked about how now our Black women are 60% were now seeking out midwifery services because they're scared of going to the doctor because of all the things that have been reported as far as mortality rates among our Blacks. And so we can change that narrative. We have the power to change that narrative. Yes, we know it's based on systemic racism, you know, the racism is there. We know the disparities are there. And we know there's things that they need to do. At the same time, I feel like we as the village can do more as well in that space of educating these women, pregnant and postpartum women, and their families. So let's be more, as I said earlier, let's be more intentional. I'm honored to be able to share this and connect and collaborate on every opportunity I get until the U.S. becomes one of the safest places for women to give birth. Because a safe pregnancy and a safe delivery and appropriate postpartum care is a right and not a privilege. Thank you.
I would just start off by saying we need you. Everybody in this room matters. Your voice is needed. Your presence is needed in the lives of saving women or families. I'll just say generally families and healthy babies. In the United States, I will say this about the presence of violence in the relationships, that more than half of women killed by guns and gun violence are killed by their intimate partners. It doesn't matter if you are not an expert in intimate partner violence or, just you alone. We need you. We need you to be educated, to be a soft landing place for someone to come and say, hey, I'm not in a great situation, because that question may be missed on a screening, okay? These type of conversations you have by relationship, where someone can disclose to you what is really happening within their home and within their relationship, and especially on top of a pregnancy that may be even more complicated. So I want you all to walk out of here knowing that you have power, just by the power of presence, power of education, to make a difference and save someone's life. There's so many women who are gone, deceased now, and maybe their lives would have been saved if someone asked the right question or had the right relationship established with them. Maybe they would have still been here. So just think about that as you interact and do this work, and you're passionate, and you're in your work, but also think about other communities, your faith communities or other places you're connected to, making sure you are establishing those relationships and educate yourself on why this issue is so prevalent and oftentimes goes under the radar. So we need you. You matter. And just thank you for doing the work that you do.
As we were sitting at lunch today, many of us strangers, we went around the table and we talked about why we're here doing this work. Why do we do this work to begin with? And the common theme and the common thread in everyone's story is that there was something that happened in their life along the way that brought them to this. And I imagine that holds true for all of you sitting here today. What was it that brought you here today? What was it that brings you to this life-saving work, this really meaningful work? One of the women that was sitting near us said that her mom was a wonderful labor and delivery nurse, and she died of obstetrical cancer. And this beautiful woman sitting near us said that she was starting her residency to become an obstetrician. She had been so inspired by her mom. And one of the things she said was, and what I noticed in the theme of everyone sitting at that table, one woman had lost a cousin shortly after childbirth, giving birth to her baby niece. And one of the things that was the theme was that I'm here to reclaim it. I'm here to reclaim what happened to me to change it for other people. And so I would just say thank you for changing the narrative. Thank you for reclaiming it. Hopefully there's healing in this work more than there is trauma. I wish that for you, that there is more reclaiming than there is trauma, and to take care of yourselves in this work, because it is so hard. It can be so hard. I hope that you find more joy in it than you do heartache. And I hope that you take care of yourselves along the way. My mom always said you got to put your oxygen mask on first before you can take care of anyone else. So I'll leave you with my mom's advice as well. Put on your oxygen mask first when you can.
And then finally, I'll just say that I'm happy to see this work is being done outside of Black Maternal Health Week. One maternal death is one too many. So again, we have much work to do. And let's get in some good trouble. I'm looking forward to coming back here in October for the Mom Store. And let's get out here and let's do some work. Let's not just talk about it, let's be about it.
Woo. All right. Yes. Just want to thank all of our esteemed panelists today. And then also announce that we are having a reception in the ballroom. So if you have additional questions, you want to network a little bit more, you didn't have the opportunity to speak with someone earlier, please use this opportunity to do so. We'll have some refreshments upstairs, but just wanted to thank you all
Thank
and
you,
thank you
Benita.
all
Thank
as well. Thank you for all
Thank
that you
you.
are and all that you do.